This is genetic counseling tutorial presented by SchrDbb with reference ABC of Clinical Genetics by Helen Kingston. So, in this genetic counseling, you have to know the definition and the aim of genetic counseling. So, the definition of genetic counseling is a communication process that deals with human problem associated with occurrence or the risk of occurrence of a genetic disorder in a family. So all this has already been seen in the introduction to genetics. We said that clinical genetics involved with counseling patients in order to know the cause of a genetic disease. The second thing is to prevent the recurrence of a genetic disease. So that is the basis of the genetic counseling method. Now, in genetic counseling, is mostly involved with two main people. The first one is a clinical geneticist, and the second one is a genetic counselor. A clinical geneticist is one that has gone through medicine school in order to diagnose genetic disease, while a genetic counselor may just be a nurse or any person that has just taken a degree in order to speak with patients and to reassure them such that they can know their state and to know how to prevent their different diseases from the different genetic diseases from occurring again. So understand, so what is the aim? So understand the diagnosis, prognosis and available management. Second thing is genetic basis and the chance of recurrence. Third thing is option available. So all that has been done already. Now choose. So in order to choose, you have to choose one. You have to choose now the action that are going to be appropriate for personal and family situation. Example, if because in order for you to prevent the recurrence of other genetic diseases, the genetic counselor is going to the clinical geneticist is going to advise the parents to do prenatal diagnosis. Is it clear? So prenatal diagnosis is very important now to prevent the recurrence of the disease. So immediately you diagnose a clinical genetic disease before the child is born, you can now do an appropriate measure that can be for personal or family situation. Example, it may be terminating the pregnancy immediately you see it. That's an appropriate measure that can help the family. Example, the family may not be rich enough to take care of that child with sickle cell or with having cystic fibrosis, so they may ask to terminate the pregnancy, or the family may have the need to take care of that child, and they continue with the child until the child lives in adulthood. So you have also adjust how for psychological impact to the family and all that. So the psychological issues, as I've initially said, so the parents of the patient are going to be psychologically disturbed. That why is that they are the only one that only get that particular genetic disease. So they need a very good genetic counseling in order to help them to understand that it is not their fault, it is the fault of the genes. So they have inherited the genes from their parents, and they are only transmitting that improper gene to their generation. Though there are certain conditions with genetic mutation that may occur. Example, genes are produced by the parents who are carrying the genes. There are certain genetic mutation, or you can even have gonadal genetic transmission, which may occur only from the parent that are transmitting the genes. But usually, genetic diseases which are transmitted by single gene method from Mendelian theorem are not transmitted by the parent themselves, but instead from their inheritance. So, as we said, there's guilt and blame. The parents are going to have that. We have reproductive decision making. Now they are going to try to have different reproduction decision making to do the prenatal diagnosis and all that. Now, in reproduction decision making, it's also very important. Let's say that the genetic component of the parents has been shown, and the sperms of the father has been shown to have genetic mutation that are always going to give a high risk of the patient, of the children of that father, to have genetic diseases. Example, if the father has a Obersonian Translocation 922, is it clear? Let's say, so we are going to see what is Obersonian Translocation. Obersonian Translocation is just a balanced translocation where only one chromosome is going to exist. Is it clear? When it's translocating, it's produced from different chromosomes. So if the father has a Obersonian Translocation 922, now that's a Philadelphia chromosome. Now this father may not have any disease apart from the risk of a leukemia in future life. Is it clear? He may not have any disease, but he's going to transmit multiple aneuploidies or triploidies to his children. Is it clear? So you are going to now try to find different reproductive decision methods for this father. Example, you have donor sperms that may be used, and if the mother has a problem, you may also use donor eggs. Is it clear? So what are the possible reproductive methods? You have pregnancy without prenatal diagnosis. Is it clear? If you have pregnancy without prenatal diagnosis, you have to take the risk and you have to limit the family size. So provided that the patient don't want to do prenatal diagnosis, you have to take the risk. Let's say that the risk for having a sickle cell child in your family is 1/4. You take the risk of having that child, and you limit the size, because if you increase the size, you increase the probability for you to have that sickle cell child. The second thing is pregnancy with prenatal diagnosis. Now, if you do prenatal diagnosis, the prenatal diagnosis may be chorionic villus sampling, very important. Amniocentesis, very important. Ultrasound. You also have maternal blood sampling. So those are very important things that can do prenatally. Now the next thing, you have donor sperms can be used. Donor sperm can be used if you have a male autosomal dominant disorder. So you may have also a male, I like achondroplasia. Achondroplasia is an autosomal dominant disorder. You may use donor sperm. Male partner has chromosomal abnormality, like I've initially said, a 922 translocation. You have both partners are carrier of autosomal recessive disorder, but autosomal recessive disorder at least may be comprehensible. So it is not that's why it is at the tail end of donor sperm. Now donor egg, if you have a female partner who is carrier of an X-linked disorder, you may use a donor egg, because all her male children are going to be affected with that particular disease. Female partner with autosomal dominant disorder, you may use a donor egg. Female partner has a chromosomal abnormality, same thing, and both partner having autosomal recessive is at the tail end, because you have a probability of having good children, normal children. Pre-implantation genetic diagnosis and in vitro fertilization can also be used before implantation. So you do in vitro fertilization, and before you implant into the mother, you first do genetic diagnosis to reassure yourself that zygote that you're implanting has no genetic abnormality. The next thing is contraception. But contraception, if you do contraception, you are not going to have children. That's the problem. Sterilization, if you do that, you're not going to have children. So those ones are at the tail end. So all families, the main thing that is involved, involved in the joy of a family, is a child. So contraception, sterilization are actually at the tail end. So adoption may also be another factor, and it's still at the tail end, because everybody want to transmit his gene to the next generation. Now the next one is lay support groups. So these are now the different method. Now is still in genetic counseling. So when you want to support the different parents that are affected, you can use these support groups with their different links involved, according to ABC Clinical Genetics by Kingston. So now these are the different clinical genetics, so I'm not going to speak about that, all this involved. So the next thing I'm going to speak about is genetic counseling around genetic testing. So genetic testing is defined, so you need to know that what we have different terms that can be used. Diagnosis. So when you say diagnostic, it means that you want to confirm a clinical disease based on the symptoms of the patient. So when you say that you are diagnostic, you want to confirm clinical disease based on the symptoms that you have. Now, pre-symptomatic confirm that an individual will develop a condition later. So you may have the gene in yourself, you are pre-symptomatic, you don't have the symptoms now, but you may develop the symptoms later. That one is pre-symptomatic when you use the word pre-symptomatic. Susceptibility is identify an individual at increased risk of developing condition later in life. So we have increased risk of developing that condition later in life is susceptibility. Now, a carrier identify a healthy individual at risk of having now children with that condition. And then prenatal is diagnosis of the affected fetus or before the fetus is born. Now, genetic counseling, you said one or more, you may have one or more sessions. You have molecular confirmation of diagnosis in affected relative. You have discussion of clinical and genetic aspect of the condition and impact on the family. So patient request test intervals. So we have pre-test counseling and all that. So this is at least one session seen by 2 members of the staff. And I said when you have the clinical genetics, the 2 members in counseling, you have clinical geneticists and you have a genetic counselor. Those are the 2 main people involved. We have involvement of partner is also encouraged. So one person is not the sole member of the family. So it is both partners that are going to be involved in the family. So it's encouraged. You have full discussion about motivation for request tests. So you have to do genetic tests, cytogenetic, biomolecular genetics, and biochemical genetics. Alternative to have a test. To having a test, you may also see different alternatives to having a test. You have like the divorcing, but divorcing is not actually a very good term. So because you have to test yourself in order to know. You have full discussion about motivation for request test, alternative to having test, and potential impact of the test result. Like if you see that you and your wife have both autosomal recessive condition, you have to have psychological thoughts and social thoughts about your relationship. Is it clear? Now the next one is carrier testing. You can do it with cytogenetic method and all that. You have prenatal testing, so I'm not going to speak about that and all that. So from here we have finished with the things involving genetic counseling. I say thanks for your kind attention. Don't forget to like and subscribe for our channel. Thanks very much.